Alright, now we continue talking about burns, the emergent phase, and treatment that is being done by nurses. So we got gastrointestinal support. So there's a high risk of Curling's ulcers, and we're going to use the ranitidine and the sameprazole, all kinds of antacids to prevent stomach acid. And then to prevent Candida albicans overgrowth, we're going to use the mycostatin nystatin. Also, if they, from a relative or from their record, you find out that they haven't had a tetanus shot in the last 10 years, they need one. They need a tetanus shot because during the burn, who knows, maybe some, I think it's spores? I think they have this like capsule. The bacteria has a capsule that prevents it from dying, and once it gets into hospitable environment, it starts to becomes a bacteria and secretes some kind of proteins that cause the reaction. So they need a tetanus shot. So antimicrobial agents, they can use silver sulfadiazine cream, can be left in place for 3 to 14 days. I got this image from the OneNote. OneNote for Windows has provided the image. Check for allergy to sulfur with for any antimicrobial agents containing sulfur. So one of the things before putting this good cream on, we have to check for the allergy to sulfur. Antibiotics used for sepsis or pneumonia with a multi-organ dysfunction. Candida albicans and lactobacillus are treated with mycostatin and lactobacillus. Nutrition. Nutrition to decrease the complication, increase the healing. They try to initiate nutrition as early as possible. So burns less than 20%, total body area, non-intubated patient is able to eat enough. Enteral feeding is over parenteral, so they would prefer the feeding through the gut instead of through the veins. Enteral feeding 20 to 40 milliliters per hour and increase to the goal rate of over 48 hours. Insert large nasogastric tube. Check gastric residual for to rule out delayed emptying. Assess bowel sounds every shift. Hypermetabolic state occurs after major burn injury. Increased by 100% more. Increased by 100%. Core temperature increased. Catecholamines are increased. Increased heat. Increased protein breakdown. Gluconeogenesis. Caloric needs become higher. Protein powder is given, and supplemental vitamins and iron supplements. Alright, this is it for the emergent phase.